Madam Chair, I want to start by thanking you and thanking Chairman Pallone for including my bill, HR, and Representative Carter's bill, HR 3935, the Protecting Patients' Transportation to Care Act, in today's hearing. HR 3935 is pretty simple. It just codifies what's already in rule, and that's important. And it codifies something that is beneficial and is helping us. You know, I've been in the state legislature. I was in the state legislature for 10 years. I've been in Congress now for 5 years. One of the most difficult tasks I've had as a healthcare professional is explaining to some of my colleagues the value of and benefit of healthcare and well care, of making sure we're getting patients the care that they need, and how it can actually save us money and save us a lot of money. But all this does is to just codify current regulations that the states have to offer non-emergency medical transportation for medically necessary services to patients who don't have access to transportation on their own. Now, I represent a lot of South Georgia, a very rural area, and that's very important. However, it's important to note also that this could have an impact on people in urban areas just as well. There are certainly people who need this service in the urban areas just as we obviously need it in the rural areas. Now, to tell you the truth, generally speaking, I'm not in favor of mandating things and of codifying these type of things. However, the benefit outweighs the risk here. There's no question about it. The benefit of this far outweighs any risk. And having said that, I will say that there are a number of my colleagues who have expressed some concern about fraud, waste, and abuse. And I get that and I understand that. This bill actually addresses that as well, and actually puts some areas in place, some programs in place to make sure that we're checking on that. And we're going to continue to work on that. It's extremely important. But the lack of access to transportation can be a barrier across the country. And as I say, patients who use the non-emergency medical transportation benefit do it for a number of reasons, for a variety of reasons. Dialysis would be one, and that's a perfect example. Substance abuse, and let's talk about that for 1 second. This committee, in a bipartisan effort, as I've always said, that I think this is the most bipartisan committee in Congress, and I do believe that sincerely. But what we've done for substance abuse and for addressing that situation, this is an extension of that. We need to make sure that people have access to those programs, so that's vitally important as well. Mental health treatment, day support for patients with intellectual and developmental disabilities, physician services, pharmacy services, physical therapy. The list goes on and on. All of these are extremely important to making sure that we have a healthy citizenship, and that's very important. So it's no surprise, and just to give you one example, it's no surprise that people who miss medical appointments due to a lack of reliable transportation experience worse health outcomes and are more likely to end up in the emergency room. You talk to any doctor, you talk to any hospital administrator, and they will tell you, where's the main cost? Emergency rooms. We got to keep people out of the emergency rooms. We got to get them in the habit of primary care, of getting them in the habit of making sure that they are not using the emergency room as their primary care physicians. There's a study from Florida State University that found if just 1% of non-emergency medical transportation trips prevented an emergency room visit, the state of Florida would receive a 1,108% return on investment. Now, who wouldn't take that? So I'm just trying to show you the value of this, because I believe there is a great value here. So, as I said, we're going to be working on this as far as the fraud, waste, and abuse goes. Think about the future. Now we've got Uber. Now we've got Lyft. We've got other things. And this requires the states to use prior authorization or some other form of utilization management to help cut down on bad actors. And we have bad actors in everything, including this. We need to do that, so we've got stipulations in here for that. Have I missed anything?
No, you haven't missed anything. But what I was thinking about was an individual, say somebody who's frail and elderly, and as people are living longer and diagnosed with dementia and Alzheimer's, this benefit is cost effective and ultimately a cost saver, helping people stay in the home, reducing hospital visits, reducing ER visits, and allowing people to live in the community. And it's difficult to quantify what that would mean for someone's life, but this benefit, although it's not highly utilized, it's very important and vital to keeping people healthy and at home. So
Great. Well, thank you. And I know I'm out of time, but before you go back, I'd like to submit the following letters for the record. These are in support of this bill from Generate Health, Access Living, Greater Hartford Legal Aid, Connecticut Legal Services, New Haven Legal Assistance Association, Together Colorado, Center for Health Progress, American Network of Community Options and Resources, Community Catalysts, and Georgians for a Healthy Future.
Wonderful. So ordered.
Thank you, and I yield back.
So
Thank you, Madam
ordered.
Chair.
I would just like to say about this about Mr. Carter's bill. I think it would be a godsend to people, in plain English. Just a godsend.